Welcome back. Now it is time for the discussion segment. Today's Health Thursday, where we discuss everything relating to the health and healthcare of an individual or a person, whether it's being a man or a woman or a male or a female. Today we'll be talking about something that is very much peculiar to the female gender, that is peculiar to the female gender, like I said earlier, and to those who are growing up. You talk about the young woman, and it is polycystic ovary syndrome, popularly known as PCOS. So I have here with me, she'll be joining us via Skype. She'll be talking about everything that has to do with the PCOS, what it means, how it can be managed, and how what kind of symptoms it gives before a person can know or should go to the hospital to make sure they do a test to detect if it is PCOS or not. So we'll be talking about everything that has to do with PCOS and how it can be managed. And like I said, the guest will be joining us via Skype, and she goes by the name Miracle Okafor, she is a PCOS awareness advocate, and she'll be joining us via Skype today. Welcome to the show, ma'am.
Thank you very much. Thank you very much. I do appreciate you.
Yes, ma'am. How are you doing today?
I'm doing well, and how are you too?
I am fine. Thank you so much for asking.
Yes,
Let's go straight into it. Like I said earlier, we'll be talking about PCOS and everything that has to do with it. And before we delve into the major needs or the major topic of the day, can you give us maybe a background story? I know that you are a PCOS awareness advocate. So can you tell us what prompted you, or what pushed your interest into making awareness for PCOS immediately to the women or to the females in your area?
All right, thank you very much. PCOS is a very very peculiar topic, and is a topic I'm very passionate about because I have people around me that suffer from PCOS. So it's something that actually spurred my passion to become a PCOS, an awareness advocate. Yeah.
Okay, thank you so much for that. So now let's move on to PCOS. What exactly is, the polycystic ovary syndrome? Many people say, oh, PCOS there, PCOS here, and you hear people say, a female or a woman has beard, or she has this, she's becoming fatter, she has bloated stomach, and all of those things. So we are here, we've heard so many things about it, but then we want to know what exactly is it. As much as we've heard so many things about it, many people do not even know that there's something called PCOS. Many people are not aware of it, and I just realized that we are just coming up to talk about things that has to do with the female gender, especially things that has to do with fertility or the reproductive organ in the female body. So what exactly is it, and what can be done? Basically, let's talk about what PCOS is exactly.
All right, so PCOS, first of all, is polycystic ovary syndrome, or polycystic ovarian syndrome, whichever way you want to call it, and is a hormonal imbalance, and it's caused by hormonal imbalance majorly. It affects 1 in every 10 women. That is according to WHO statistics, but if you look at it critically, it is much more than that. It is very common. It is much more common than we think, because so many persons go undiagnosed. So many persons don't even know what is going on with them. So let me say, we can just say 1 in every 5 women has PCOS. Yeah.
Thank you.
Okay. Okay, so looking at the symptoms, you just mentioned having beards, infertility, and all that. Those are some of the symptoms that this PCOS thing presents. There are so many other symptoms that we even overlook, and these are some of the things that PCOS can bring out. Yeah, so it's a very complicated medical condition. It's a very complicated medical condition. Yeah.
Okay, so let's move on to the symptoms. Can you give us, some of the symptoms that many people can even overlook? We've talked about the ones that can easily be detected, but then what other symptoms can a female or a woman who has PCOS, what should they be looking out for when it comes to the body?
Okay, so some of the very common symptoms, you have infertility. Some people don't even know they have PCOS till they start trying to conceive, and they go to the hospital and they say, okay, you have PCOS. But some of the symptoms we do not look at it, or that is also common, or we overlook, is things like insomnia. So many persons with PCOS have sleep disorder. They don't sleep well, or they may not be able to sleep. Yeah, so that is one. Secondly, another thing is anxiety and depression. Most PCOS women are very prone to depression. You see their hormones, their emotions, their moods are all over the place. They have all mood swings and all that. These things, sometimes we'll be like, this girl, get her she do. But at the end of the day, it's actually her hormones that is making her act that way. And that's all thanks to PCOS. Another symptom that we don't look at is hyperpigmentation. That's like having some darkening patches over the skin, like, between your thighs, your arm, that's your armpit area, your eye circle, and all that. You also have things like acne and all whatnot. We know some people actually, they become very fat and they find it very difficult to lose weight. But there are also some people that are actually slim and they have PCOS. So these are some of the funny symptoms, and some symptoms that we just overlook. And we say, we don't know what is wrong with her, but all thanks, PCOS is actually the culprit of it all.
Thank you so much for that. Well, let's talk about what age group or what age grade is this the PCOS is really common amongst. Many people say, for people, majorly people who have PCOS are people or who know that they have PCOS are those who are married, or those who have maybe there's a symptom I actually wanted to even mention, that is cis menstruation, or cis period, part of some of the symptoms that can happen to someone who has PCOS.
Yes. Irregular menses, cis menses, it's part of, that is one of the common things. Like, that is one of the things that will happen and say, what's going on with my menstrual cycle? And you go to the hospital. That is like one of the first pointer that you have a PCOS. Either your period is very irregular, or you see some period for 2 years, for 1 year, for 8 months, they've not seen their period. So that is also PCOS. Yeah, so that is like the most common symptom of PCOS. Now, you talked about what age group and what age. Yeah, so any person that is of childbearing age, that is like anybody that have started menstruating from, like, let me say 16, 15, 16, 18 downwards can actually have PCOS.
Okay, and then if it is not detected early enough, what do you think there is any long-term health impact on it, or is it that they're not going to give birth, or women with PCOS will not have children, or maybe it can result to death, or just let us see what's long-term impact if it is not detected early.
Yes, PCOS has a long-term effect because PCOS is you're not only prone to infertility, so to say, when you have PCOS. You have other diseases or other ailments that you're exposed to. Things like heart disease, diabetes, high cholesterol, high BP. These are some of the things that if you have PCOS, you are very, very likely to have them in future. So if it's been detected early, it is key that you start putting things in place before it becomes worse. You get to like maybe having heart problem, or maybe having diabetes and all that, even kidney problem, even liver problem. With PCOS, you can have things like fatty liver and all that in future. That is if you don't start managing it on time.
Thank you. So let's talk about the management of of PCOS. Now, first of all, do we call PCOS a disease or maybe a disorder?
It's not a disease, it's a disorder.
It's a disorder. Thank you. Okay, so let's talk about how to manage this disorder. What can be done? What kind of food can be eaten? What kind of drugs should be taken when it comes to managing PCOS for someone who is who's of the childbearing age and is looking to to give birth in the future?
Okay, so management of PCOS firstly starts from knowing the root cause of PCOS. Now, there is no actual cause of PCOS, but there are suggestive causes of PCOS. Things like insulin resistance, you have inflammation, you have things like high androgen and stuff like that. So before you start with management, it's good where is it coming from? What is the root cause? So for example, if you maybe gone, and for you to go know the root cause, you have to do some medical investigations. Yeah. So for you to say, okay, I want to manage this effectively, you start by knowing the root cause. So for example, you have insulin resistance. The very next thing you need to do is now, insulin resistance means your body not able to utilize the insulin. So you have like a flooding of insulin in your body. And that has to do with blood sugar, high blood sugar and all that. So if you have insulin resistance, the first thing you need to do is to start managing your sugar level. I'm not saying that you should not eat sugar and all that, but you need to manage your sugar level. Things that you need to eat are things that will balance your sugar level. And those things include eating things, protein, having protein in your diet, having food that are rich in omega-3 in your diet, having food that are rich in healthy fats in your diet. This food will help you control your insulin, your sugar, your blood sugar
level,
balance.
insulin level.
Yes, there are so many other things that you can do also, because there are some of the practices that we do on our own that at the end of the day it spikes your insulin level. You know, some people go about and they said, I'm starving because I want to lose weight. I have PCOS. I'm on the big side. I want to lose weight, and you see themselves starving. Now, if you have insulin resistance and you're going through that route, you may be worsening your case because you are giving your blood sugar level some form of imbalance. Now, but if you have some other form of PCOS, some other causes of PCOS, yes, you can go through that route to do some kind of restrictive diet
regimen,
right? So, yeah, so the thing is, you know your root cause and you follow it one after the other. Right. So like if I mentioned insulin resistance, the other one is things like inflammation. Now, if your PCOS is caused by inflammation, what do you need to do? You need to eat more of anti-inflammatory food, right? And you need to stay off from all this processed food, because they have things that will cause inflammation in your body. These junks, soda, this, that, you need to stay off them. Processed sugar and all that, you really need to stay off them.
Okay, thank you so much on that. And can PCOS be corrected, or can it be managed through surgery or surgical means?
Yes, it can to a certain extent. Yeah, PCOS actually do not have a cure, but it can be managed to the barest minimum. Now, if you want to go through, if your PCOS have generated into like ovarian cyst, or you'd have ovulatory problems, there is a kind of a surgical procedure that you can do to make you ovulate. But that is like the last opinion for every other person, because you know, most of those things have somehow a repercussion, but that is always the very last option to go for.
Okay, thank you so much on that. I know that you are an awareness advocate. You go out you run an NGO that basically talk about making awareness on PCOS and everything that has to do with it. So in your experience, what are the common misconceptions or myths that you have encountered when it comes to talking to women about PCOS? As much as I know many people are not so aware about, you know, something like this. Even talking about hormonal imbalances and all of that, many people are not so aware about it. So in your experience, you know, going to the streets talking about, you know, all of these female issues, majorly on PCOS, what are the myths you've heard or misconceptions that you've heard that, you know, you'd like to talk about here and make people know that that is not true?
Okay, so the very first one that I heard, I think that was 2019 or so. It's you know, most times women with PCOS, they have beards. That is especially those that have high androgen. And I hear that women with beards are usually very wicked, and I don't know where that comes from. And I try to tell them that, oh, these people have hormonal imbalance. It has nothing to do with their character. They are not wicked. Do you understand? That is the first I heard. Then, you know, some people are just you know, we are in a part of the world that we are very sensitive with our body, and most of them try to lose weight. You know, you see people that are trying to lose weight, but it's not just working because of their hormone, and they see you as being lazy. Yeah, there is another thing. You know, some people are just not like they are lazy, but they don't have the energy to work, and because that is another symptom of PCOS. You're just let me say, your energy level is like on a 0%,
very low,
and most times very low. Sometimes you wake up, you're already tired, and most times they see this side of people as being lazy. You know, you may have a teenage daughter that don't want to, not like she doesn't want to do anything, but she doesn't have the strength. And you hear things like, this girl is too lazy, this girl is too lazy. She may be having PCOS. That is what is making her weak, so to say. Do you understand? Then another misconception is, you know, most times you see people that mental health is something that we don't really take so seriously here. And you see people that are very prone to depression, very prone, and they said maybe it's from the village, one witch, one something. She has, you know, one spiritual problem, you know, and you start dragging her from one church deliverance service to the other, not knowing that she has hormonal issues. She has no demon disturbing her. So these are the things I've heard over time. Then the last is for those that are trying to conceive, you understand, and you go to the hospital and maybe they say you don't ovulate, and you hear them, oh, she's not a man. You know, you hear things like that, like, oh, leave my son alone, you are not a woman, you're not this, you're not. I've heard a lot of them, and you know, I try to let them know that those things is actually PCOS and it can be corrected. That is even it. With simple things, you can correct them, you know. So it's not like she's now a man. She's not a man. She still have ovaries, she still have functional uterus. So she's a woman.
Thank you so much. I want us to talk about, you know, what are the things or what lifestyle changes can be adopted in order to correct, you know, PCOS. But before that, I would like to ask that, you know, can PCOS be, is it something that can be passed on from maybe mother to daughter? You know, is that something that can happen?
Yes, PCOS can be genetic. PCOS can go from mother to daughter. A PCOS woman has every likelihood to have a PCOS daughter. And recent studies even shows that to a very certain extent, it can go to their males. That is the recent study on PCOS. So if you have a PCOS mom, a PCOS sister, there is every likelihood that it's still revolving around the family.
Wow. Okay, let's now talk about the lifestyle changes that can be adopted when it comes to, you know, managing this disorder, or to correct the disorder rather, not even managing it, but then to correct it. What kind of meals can be eaten? You know, I know we talked about, you know, insulin level and all of those things, but then what kind of everyday meal can be eaten to manage? Because in losing weight now, let me use a popular example. When losing weight, you hear people say, oh, you must not eat this, you cannot eat that. The only thing you can eat is just vegetables or just your grains. You cannot eat any other meal. And it's always, for people who are trying to lose weight, it's like a torture. Why are you depriving me of foods that I really want to eat, or even depriving me of carbs or even junks, you know, just because I want to lose weight? So what things can be done? You know, if it's just so that it's not going to look like, you know, they are losing out of life or losing out on life because they have a certain disorder.
Yeah. So what I always advise people that I talk to and I manage is, one, your plate should have protein. Your plate should have vegetables, folate. Your plate should have healthy fat. So, for example, you know, sometimes you say, oh, you have PCOS, don't eat rice. And there are people that really love rice. It's all about the combination. What do you combine your rice with? So you can just take like 2 spoonfuls of rice, add vegetables, which it will give you the folate. Maybe you can add avocados, which have healthy fat. And maybe you can just eat it like that. Or if you have extra money, you can add egg. And you're good to go. So protein, make sure you have protein, healthy fat. When I say healthy fat, I'm not saying fats from junks. Healthy fat is gotten from fruit. Avocado is one of them.
Okay.
From avocado, you can get healthy fat. So you can get those stuff, you add them in your food. So it's just how you combine your food, and you know, and you're good to go. Now you can also eat fish. If you have PCOS, you need to eat fish because fish has omega-3. Fish has omega-3, which also helps you, right? Then protein, I've mentioned protein like severally because protein is like a must. It's like a must have in your diet. Then for the carbs, when you're eating your carbs, always combine it with healthy fat or with protein. Always have it all combined. Don't just go ahead and just eat your carbs just like that. Have it all combined.
Thank you so much on that. Now, talking about the awareness, this is 2023, and we just see that people are beginning to open up or speak up on, you know, female issues when it comes to the reproductive organs or system. In your experience so far, do you think the awareness is getting somewhere? Do you think that people are beginning to be more aware about, you know, things or issues like this, and they are gaining confidence in the fact that they need to speak up when they begin to see symptoms like this?
Yes. I feel the awareness is actually beginning to really gain ground, and I can say I'm very happy about that, because that is going to really help people know that, okay, this is what's up, this is what is happening, and it will make us be less judgmental on people. Yes, awareness is actually getting somewhere. I am happy people are actually speaking up about the awareness, and it will also make other people, like a non-PCOS person, to know what is going on with a PCOS woman and know how to manage them properly. And it will also make us to be less judgmental on each other. You understand? It will make us to be less judgmental on each other, and it just help us have more empathy on these women.
Exactly, that I agree with you on that. It's very much important that we are less judgmental and more caring, or have more empathy towards people that have, PCOS. And do you think that in the coming futures there will likely be a drug, or maybe probably a vaccine or something that can help avoid all of this, instead of managing it, instead of managing PCOS? Do you think that in the coming years there could be maybe plant-based drugs, or maybe a supplement or something that can help correct all of this? And do you hope for that as well?
Yes. I am actually doing a research presently to that is my own personal project. I'm doing a research presently if there is any drug or anything that can be taken, and you just get it off immediately without going through this very, very long route of management. So I am hopeful. Personally, I'm doing my own research, and I know there are so many other scientists that is taking interest in this topic or in this disorder, and are trying to see, okay, how do we go about that? But before the drug and vaccination or whatever that could come out to control PCOS, I think we on our own need to start controlling it from what we eat, what we are exposed to, because it's actually a hormonal disorder. It's a form of hormonal imbalance, and if we trace it down, this hormonal disorder is actually from things we're exposed to. There are so many. There's something they call endocrine disruptors, and these things, they act like they are normal hormones, and when they get into the body, they are like what I call unfriendly friends. They act, I'm your friend, and when they get into the body, they are on another mission to disrupt the normal functioning of hormones. So if we can start by controlling that, some of the things are like exposure to like plastics and all that. There are lots of endocrine disruptors that we are exposed to on a daily basis. I know we cannot totally control these things, but the ones we can control, if we can control them, then that is a way forward in managing it and not passing it on to maybe our daughters. Then another thing is also what we eat. We don't eat healthy anymore. Now, people of the old, they are not as sick as we are right now, and they don't really have this medical attention that we are having right now, and they were stronger than us because of virtually what they eat. These people eat healthy, they eat straight from the farm. They are not exposed to a whole lot of things. So if we can go back to that age, if we can go back to what those people were doing, I believe we'll have a way forward. This thing started when we started eating things that are all genetically processed or genetically modified, so these things have a way of getting into our body and causing issues, and most times they are all registered in our gene, and when we have our babies, we are all passing it down, and you see all forms of different disorder coming up, which is not supposed to be. So while we wait for a medical intervention in future, we can start by doing this on our own.
Thank you so much for that, Sam. I really appreciate it. I wish that we could go on, but we are actually running out of time. Thank you once again for your time. Thank you for making us aware. I'm sure that our viewers have listened and they are more aware, and of course they pass this knowledge or this information to other people. So it goes a long way to make sure that PCOS warriors, PCOS survivors come out to speak more and be more open about all of this, so people can learn and get better at managing their eating lifestyle. Thank you so much once again for your time.
Thank you so much. I do appreciate your time.
That's all we have for you on the interview segment for today. You've heard our guest. PCOS is a disorder. It's not a disease, and we need to be more empathic to PCOS warriors, like we call them, and also for those who have survived PCOS, or for those who have effectively managed it and are living with it. It is very, very much important that we come out to speak up. We speak out about it, because it can help give confidence to the next person, give confidence to the next lady, and everyone who has the ability, who has the who can do it effectively, who can make the awareness effectively. It is very much important that we partner with NGOs, we partner with individuals who have chosen to take the part of making sure that PCOS is we are well informed. Rather, we are well informed about PCOS and everything that has to do with it. Right about now, we'll go on a short break. So we'll be back with Daybreak Africa. Just stay with us.